There's now a fair amount of literature, though, that shows that cancer patients seem to be at increased risk of death. But what we tried to do in our paper was to say, well, it's not just about having cancer. So having cancer seems to increase your risk. Having chemotherapy recently seems to increase your risk. Being older increases your risk, and so does being male. So what we tried to do is use the available data to turn that into a sensible model. So to say, well, if you are 65, a 65-year-old man, you shouldn't think about the risk of COVID in the same way as you should if you're a 25-year-old woman. And so what we're trying to do in the paper is to tease those numbers apart to provide oncologists and their patients with some tools to think about those risks and think about balancing those risks. And one of the things we've done in the paper is we've compared the risks of dying because of COVID with the kind of magnitude of benefit that you get from giving chemotherapy. So if you give adjuvant chemotherapy for many breast cancer patients, you will improve survival by between about 3 and 6%. Those are the kind of the figures you're looking at. And so if you say, well, that's how much chemotherapy improves survival by, you can then say, well, what's the risk if you were to get COVID of dying? And so we're trying to provide some numbers to allow patients and clinicians to roughly balance those things. And we're clear that our numbers aren't perfectly accurate, and I don't think that perfect data exists. But we've had quite a lot of feedback from clinicians that it's really nice to be able to have something concrete to discuss with patients and their families. So there are a couple of things. There are some bits of healthcare that are riskier than others in the context of COVID. So a good example is having a major operation and a general anaesthetic clearly carries with it large risk. So you might have to treat some of those patients using radiotherapy instead of surgery. So that's a nice replacement thing. The second thing, though, is really it's about reducing the risk of infection. And so hospitals around the world have done lots of work around trying to streamline their pathways, but also have sort of clean areas and open areas. And so all of our patients now having radiotherapy all come for a COVID swab before they start treatment, for example. And so that's about trying to reduce the risk of infection in people having treatment. The problem is the third bit is really about controlling COVID in the population. So if there is no COVID in the population, then cancer patients aren't at increased risk. But you know, that's a big issue. It's one that we've not done very well with in the UK so far. And until we get that under better control, you know, we have to remember that healthcare happens in the context of a population situated in a country. So the best way to control COVID in the cancer population is to control COVID in the population, and then the number of cancer patients who get COVID will go down. I think we're going to see more substitution, particularly around giving radiotherapy, particularly very kind of modern, very targeted radiotherapy instead of surgery. And I think we should, certainly during the first wave and probably now during the second wave, it would be sensible to expect that there should be a partial reduction in some chemotherapy activity. So there are some chemotherapies, particularly in the palliative setting, where the benefit is pretty modest. You know, second line chemotherapy for a lot of adult solid tumours often doesn't work that well. And in that group of patients, particularly in the older male patients who have other risk factors, you know, I think both patients and doctors need to ask themselves very carefully about whether the additional risks associated with having treatment during the time of COVID are worth it. Now, those are individual decisions. So I'm not saying nobody should have treatment, but just as we do at the moment, just as you sit down with a patient and you discuss the pros and cons of treatment, our paper is trying to say, well, in the context of COVID, you can sit down and discuss the pros and cons, and here's an extra bit of information to take into account.